Good evening. Welcome to Orillia Soldiers Memorial Hospital Fireside Chat. I'm Laurie Petrus, Chair of the Board of Directors here at Soldiers. It is our pleasure to share with you some of the highlights over the past year. Our batting lineup for this evening will be Carmine Stumpo, President and CEO of OSMH, Dr. Kim McIntosh, who is our Chief of Staff, and Perry Essler, who is President and CEO of the OSMH Foundation. I'll get us started. First slide, please. To begin, we thought we'd provide an overview of the array of services Soldiers provides. We play a special role in the healthcare system as we serve our local communities as well as our region. For example, we have a busy emergency department which serves as an anchor in the community for accessing urgent care. We also partner with primary care and community services to meet the vast majority of the health needs of our community. In fact, we are leaders in the province in integrated care as partners with the Couchiching, Ontario Health Team. In addition to the local services, we are regional providers for Simcoe County and the District of Muskoka in clinical areas like critical care, women and children's services, and inpatient mental health. At Soldiers, we pride ourselves on our breadth of services, both local and regional, without losing the community feel that is so important to so many people. Looking at the year as a whole, we were able to provide a snapshot of the activity of the hospital. I'll highlight a few items. Our hospital continues to grow in size and budget in response to the growing needs of our community. Our emerge volumes remain well over 50,000 visits over the year, with a trend towards higher levels of acuity. We continue to provide high volume of routine care with over 1,000 births over the last year, supporting a large number of high-risk births throughout the region. We are pleased to report for several years we've been able to double our orthopedic surgical volumes in response to long wait times. There's still more work to do here, but we have made significant progress. We have a relatively new service in partnership with community providers called Couchiching Health at Home. OSMH staff extend their services post-discharge in people's homes. Over 400 individuals have benefited from this service over the year. On any given day, there are about 100 individuals cared for in their homes instead of hospital. That's 100 fewer hospital beds being required. These examples of innovation are important for many reasons. We recognize the challenges in the healthcare system and know what we can expect in the years to come. This graph reflects a projection of the age distribution of our population over the next 20 years. We see an overall growth in population, but a substantial growth in those age 65 plus. There is a particularly sharp increase in the age of those over 80. This is a good news story as longevity is increasing in the province. It does, however, add more demands to the healthcare system. On top of the demographic data related to population growth, more people are living with more chronic diseases. For example, the prevalence of chronic disease such as diabetes and lung disease continues to grow. We also recognize there are many social determinants that impact the long-term health of communities. With an impending economic downturn, we know there will be downstream implications for the health of our community. These are but a few of the many complex factors that drive health needs. However, chronic diseases and aging are the key ones. This is our reality and our challenge. I'll now hand it over to Dr. McIntosh.
What a pleasure. Thank you so much. And thanks to those online that I can't see. So hopefully I'm flagged if any hands or questions go up. I am so privileged to have been a family physician in this community since my year of residency training in 2001, and to see this community and OSMH as a really central contributing factor in integrated care, both acute and primary care. And really, when we look at where we have come from. This has always been a community, and it's the reason I came here to study and to live and to work and to raise my family and have my babies here. This many years ago, this community really has just matured in a way that really is understandable, but through a lot of hard work and a lot of commitment to meaningful collaboration, and that's not always easy. So we have an accelerated Ontario Health team. There are 58 Ontario Health teams in the province, and the Couchiching OHT was picked as one of 2 in Central OH. So there were 6 OH regions, can be alphabet soup, so Ontario Health regions, and 2 in Central. Couchiching was 1, picked to really go forth to demonstrate collaboration, show how can a medium-sized community hospital work with partners, how can patients get care in community and have seamless transitions from hospital to home, and know who their providers are, and know who to call for care needs, and actually have a family doctor or nurse practitioner in a team to provide care. So the work has been exceptional. It continues, and these are a few examples of our chronic disease hub and our children's clinic for families with young children under the age of 18 years who don't have a nurse practitioner or family physician. And then we, of course, have our unattached clinic, which I like to call it a transitional care clinic, and that is about getting care and getting into the team to be navigated to a service. Maybe we don't quite have enough family doctors yet, but what if you need a dietitian or a social worker for mental health or a pharmacist consultation? And we really work on extending our team and everyone working full scope. That's both in community and in hospital. And the proof is in these programs that have developed through strong advocacy and strong partnerships, and the government has recognized that. Of course, in the backdrop, why all this hard work to collaborate? If we had enough providers, I mean, sadly, maybe we'd all be in silos. That wouldn't be good either. But we face a primary care crisis, as you know, with millions of Ontarians and Canadians, and actually internationally. There is a shortage of the diagnosticians, such as family physicians and community nurse practitioners, who can provide primary care. 90% of care is primary care. So when you think about that definition, 10% is acute care. So thank goodness Soldiers is there to support. But 90% of care for the average human is within that walking distance of their home, ideally, and meets all of their care needs. So our group has been following closely with the primary care action team developed through the government of Ontario with Dr. Jane Philpott. I'm not sure if you've read her book. She's a family physician, and she wrote a book about how to expand and have more inclusive and collaborative primary care. So she is leading the action team, and we have several members across our hospital and community who have opportunity to meet with her at tables, not infrequently. So Couchiching, Soldiers Memorial, and our OHT are all at times, approaching her to talk about what we are, in fact, doing in this community to try to improve care. And we, in that vein of wanting to train and support comprehensive family physicians, we were successful, as you have hopefully heard, in opening a family medicine teaching unit. That is a 2-year residency program. So doctor has to do their undergrad, which is their medical doctorate, and then have to do, this is for it to become a physician, and then have to do 2 years of comprehensive family medicine training where you work in the hospital, you work alongside a family doctor in community, you work alongside the obstetrician, you work alongside the intensivist, you spend time in the emerge, like comprehensive family doctors. As you can imagine, it's a comprehensive training program, but Soldiers and this community has done it exceptionally well. I was the second year of that program when it was like 1 year in Toronto, 1 year here in 2001. But now we, as of July of this year, opened the 2-year program. So these residents are in this community, in this hospital, and in a clinic in our community, working and learning and seeing patients and becoming comprehensive family doctors who hopefully think this is just the best place to work, and they will then stay. They don't have to. They're under no obligation, but ideally, we are, really giving them that strong learning experience of what can a collaborative community look like, inclusive of an amazing hospital. So that's a bit more about our family medicine teaching unit. So you think about our community, our footprint. We talked about primary care. We talk about care close to home. We talk about right care, right place, right? These are things you've heard. And when you look at this map, we have really worked to expand our primary care services, not just in allied and training and more family doctors and recruitment and retention, but also physically in places where folks need additional care. We opened a Lighthouse Medical Treatment Center to have care on site at the local shelter. We have our Lakehead Student Health Clinic that is co-hosted by the Huronia Nurse Practitioner-led clinic, nurse practitioners. So there's another organization, a group of primary care providers who contribute to our collaborative. And we have our Kuching Family Health Team expansion. So we have care for all in terms of allied health services. You don't have to have a family doctor to access some of the allied services that are affiliated with the health team. So we have really worked to expand strategically places for folks to get care whilst we grow toward everyone can be attached to a family doctor or nurse practitioner. And we've really worked hard to navigate folks appropriately to the right services. So then we start looking at, okay, so that's great if you live right in Orillia. Kuching OHT is inclusive of Oro-Medonte, Ramera, and Severn. So we have townships that flank us that are very broad rural geographies. And how do you get care if you live, in the far corner of Severn, or if you're out in Brecon on a rural side road? So we have also, as an Ontario Health team, focused on extending the opportunities across our entire geography. So when you look at the dots, this excites me because this is people getting primary care closer to home. And it's not all perfect. I understand there may be folks here online who don't yet have a family doctor. We have a list. You can sign up. Just tag me after. But I understand we're not there yet. But we're really focused on equity deserving aspects of our geography and improving access closer to home. And we've worked with the Ramera Council around some primary care expansion opportunities. And the Huronia Nurse Practitioner-led clinic is in Oro-Medonte, so they have a bricks and mortar strategically located for patients in that geography. And then out in Coldwater, we had a really neat collaborative family health team called the lab. The lab said, sure. The docs out in Coldwater said, we need a lab. And next thing you know, they open a bloodletting site, a lab, a satellite in Coldwater from those communications, a few phone calls from folks who have trusted relationships. And lest we forget, we have our acute care services, and I'm going to pass the baton. But you can see how the collaborative model of extending primary care, and thank goodness we have a community hospital at the center of that in terms of next steps when your care needs extend past primary care.
Oh, good. Thank you very much, Kim. It's so easy to follow you with your leadership and your energy in these presentations. It's a real pleasure to be here today. And I guess I'm batting third, which makes me Vladdy. Okay. Far from. So yes, this slide represents the work we do in acute care, and we want to recognize we are a system. We need to have, it's not one or the other. We need to have strong primary care, as Dr. McIntosh has pointed out, and we also need to have a acute care hospital that delivers high quality care. And with that, we want to recognize our surgical team, one of several that have received rewards for the great work they do. We continue to grow our surgeries. We drive down our wait times, and we do it with in a way that's a high quality, accessible service. Okay, so what's new since the last time we had a fireside chat? Well, we had the real privilege in May. We had the first privilege in April, but the second privilege in May to have our announcement of a new hospital. We had the Premier Doug Ford here with Minister Jones, Minister Dunlop, and others to announce the site. And what I will do is hand it over to the text. We want to share, we compiled a video of the announcement, and it's I can't do it justice. It gives me tingles every time I see it. So anyway, go ahead.
On behalf of the students, staff, and faculty at Lakehead University, I am so honored to welcome you here today. Today, we mark a significant and highly anticipated milestone for Orillia Soldiers Memorial Hospital, the City of Orillia, and Lakehead University.
Today is an exciting first step as we work together to explore what's next.
Partnership has been the key word throughout this journey. Partnership with our leader, Premier Ford and Minister Jones, between our healthcare leaders, all levels of government, and most importantly, with the people of Orillia. And today, we celebrate what's possible when we work together.
It's good to be amongst partners in this developing great news story for Soldiers Memorial Hospital.
Our government has been making record investments to protect Ontario's healthcare system and provide people with all ages with the right care in the right place.
This government is clearly committed to supporting world-class healthcare. The investment they are announcing today will have a profound impact on the health and well-being of our communities for generations to come. It's no secret, Orillia needs a new hospital.
So today isn't just about a hospital structure. It's about fundamentally changing and improving the health and well-being of our community and our region. We are honored that the Premier is here to make that announcement today, again. The hospital and Lakehead University are thrilled to identify Lakehead campus as the preferred site to build the new hospital.
I'm so pleased to announce a second time we're investing $3 million as the first step to building a new Soldiers Memorial Hospital right here in Orillia. Congratulations.
Okay. So for those that were able to participate, you could see the energy. It was a lot of fun. We wanted to share that with you because it is such an exciting time. The one thing I will point out, I'm not sure if anyone counted the number of times the word partners or partnership was highlighted in that very brief section. We mentioned it earlier in our talks, how we work together, whether it's within the hospital, whether it's with our primary care, and now with our new emerging partnership with Lakehead. That is a key element. We will be so much more successful when we work together. And I want to highlight how we came about this. So there was a lot of work behind the scenes. People asked us, how did you pick Lakehead? What was the process? And we want to share this, and we've been very transparent in the way that we've approached this. When we realized we were looking towards identifying a new site, we had an expression of interest. We invited all landowners across the city of Orillia to share if you have 20 acres of land, relatively flat, let us know if you want to work with us. And we received responses. We created a committee. That committee had current and former board members. It had community members, other hospital committees, our PFAC members, some of which are here today, our PFAC members, our community engagement committee. We had City of Orillia staff join as part of the process to understand how do we select the best possible partner to work with for the future site. And we engaged experts. We had an architecture firm with vast experience in site selection, create both technical criteria, land shape, size, access to services, etc. We also had community criteria. And that was interesting. We had surveyed our community to ask what was most important to you as community members. And the number one element that was shared with over 1,100 responses was parking and access to highways. One would imagine when you're not feeling well, most people are driving to the hospital. And you would also imagine if you're arriving in ambulance, you would want to make sure it's a very accessible location. So we took all that criteria, we assessed all the options that came forward against those criteria, and we are absolutely thrilled with the result. We're thrilled with the partners. The Lakehead site met and exceeded all the criteria, and that's how we landed on this location. And that's just on the geography and the size and the shape. That doesn't even speak to the opportunity of sharing resources as partners, infrastructure. It doesn't speak to the pipeline of providers and professionals that we will have with an affiliation to a university. And for the university, it doesn't even speak to the fact that the city's largest employer is next door, and we are a learning lab for new trainees that we can help shape the future of not only healthcare students, but business students, HR professionals, correctional services, etc. And we've started that work in earnest. So we are meeting already, talking about how we can design the future, not just for today, not for 10 years from now, but for 20, 50, 75 years from now. We will come up with a plan that will support the longevity of health services. So when you think of the acute care and what we're designing here, you think of what Dr. McIntosh spoke of with primary care, you can see the sense of how we are bringing together the entire continuum of care with all of our partners together to support the health and well-being of our community. So I get this question a lot, and I want to address it today. So what happens to this site? We are standing in the current Orillia Soldiers Memorial Hospital. Well, we have plans for that too, and these are very exciting plans. So we know that our community tower still has some life in it. We know that structure was built just under 20 years ago, and it still has a long service ahead of it. And we also believe we can salvage, let's say, the Soldiers Wing. It's a bit older, it's pushing it, but we feel there's still a little bit of life left in that. Everything else needs to go. The cost to maintain those 60, 70, 80, 100-year facilities is not worth it. When you clear that away, we asked Infrastructure Ontario what is the highest and best use of the property. They told us they could see a future where we have 600 housing units on site. So what a great location to create density for what we know is a major crisis in society in Canada today, which is housing, affordable housing. We also know that the hospital will maintain service here. That is a critical message. We will not be transferring all the service to the Lakehead site. We will be transferring the acute care services, the critical care services, the emergency services, but our community-based services, and I've listed a few here, our outpatient clinics, our integrated services, our community mental health, potentially substance use transitional beds, other transitional beds. These are the types of services that will remain here at this site, which we feel not only is a great use of the existing resources, but it also provides that context of those community services in the core of the community. So we're really excited about that. We have some preliminary work, and we're actively pursuing how we would best develop that concept of the existing site. So the biggest concern here when people ask, well, what will happen to the site? This site will be redeveloped. It will continue to have a health infrastructure in place. It will continue to serve. And I use this example, we're working on it, but just imagine if our current emerge, which is way too small for the people we see today, could be a fantastic walk-in clinic or multi-use clinic or interprofessional based clinic. So that's the kind of thinking we're looking at as we develop the concept and the ideas. The next question is, how can we afford all this? We know hospitals are expensive, and every community that is building a hospital is struggling with the same questions. And this slide here shows the breakdown of how hospitals are paid for. So we're really grateful for the planning grant. We received $3 million to move forward with planning, but with that is the acknowledgement that in a certain period of time, we are going to need a significant boost of money from the province. And the province typically pays for approximately 75% of these projects. And this project, we haven't recosted it because the costs keep changing as time goes on, but we are fully anticipating it will be greater than $1 billion. So it's a lot of money, but that's a huge investment of this province in this community to build health infrastructure. So that's the provincial share. The local share, the province pays for 90% of the construction and 0% of the equipment. So the local share is 10% of the construction and 100% of the equipment and anything that generates revenue. So if you're making money off it, you can't ask the province to pay for it. And I say that because parking is the big thing. You charge for parking, you got to build your own parking lots, and they can be quite expensive. So that's the local share. Where do we find the funds for the local share? Well, we call it local share, but there's a variety of sources. So as a hospital, we we have created a financial health strategy where we have been saving money for years. Just like anyone would save money for their mortgage down payment, we have been saving money knowing that this is necessary, and we continue to do so. Our foundation, you'll hear from Perry soon about the work of our foundation in fundraising, and that's something that we've been planning well in advance. And lastly, we recognize that we do this in partnership with the support of our municipalities, both the City of Orillia and the County of Simcoe. And that is an investment in the infrastructure in our communities. It Not only is there a health benefit, but there's a huge economic benefit. There will be thousands of jobs that come to this community in construction, in health, in a variety of different services, which just is a great opportunity for the community at large. So when you look at all this and we all come together and we recognize it doesn't need to be done tomorrow or the next day, we have many years to plan and save. And that's why the key message today, if as long as we start early, which we have done, we will find a path forwards for fundraising. And we're very confident about that. I'll speak more detail with the hospital component and how does a hospital raise money to buy future equipment and future construction. Our plan dictates that we have a surplus year after year, and we have cash balances that we will be investing for long-term savings. And we have been successful. Not all hospitals can say that. It's very difficult in healthcare today to be able to balance, let alone manage a surplus. And we have done so for multiple consecutive years and are pleased to be talking about things like long-term savings for a new hospital. And that has always been part of our strategy for many years. So these are a few of the messages that we've shared. We've been out and about. Our goal this past year was to get out to as many groups as possible. Here's just a small snapshot. Lori, myself, Terry McKinnon, our vice chair, we've been out to every Probus club that'll have us, Kiwanis, Rotary. We've been to all the municipalities. We've met with Rama First Nation. We've met there with any other group, OPP veterans, etc. We figure it's north of 1,000 people we have spoken to personally, not online, directly, over 1,000 people with this plan. Why? Because A, we want to share our excitement because we're pretty jazzed about where we're going as a hospital and as a community, but B, to hear back about our strategies, our approaches, and to listen to the folks. And I can say, without exception, we go to these groups and the prevailing sentiment is positivity around the plans, how we're moving forwards. And that is an important part because we're all going to have to get behind this. The new hospital is one component, but when you package it together with the primary care work, the integrated care work, we're really talking about the health and well-being for generations to come. So with that, I will hand it over to Perry Essler, our president of our foundation.
Good evening, everyone. Thank you for joining us online and in person. So the role of the foundation in what we do here in support of Soldiers Hospital is work very closely with the hospital leadership team, all members of the hospital as well. And for 40 years, this is our 40th anniversary, actually. 2025, and has raised tens of millions of dollars over that period of time. And really, the role for us is to work as closely as we can to understand the needs and make sure that we are funding what is critically important to the hospital itself to do its work. So as you can see here on the screen, ever since the beginning of time in terms of our foundation, we have funded state-of-the-art technology. We replace and upgrade equipment, expand patient partner groups, as well as provide training and support for critical programs inside the hospital, and of course the new hospital fund, and I'll talk a little bit more about that in a second. But primarily we work with you, the community of donors who helps to support what goes on here at the hospital. Last year, this is just one of the gifts that we received. It was a $600,000 donation, and it is on the Way Home unit upstairs here at Soldiers. This is the first, a new palliative care room here at Soldiers. This was funded in part by a family foundation. As I say, $600,000. This was a very special area of the hospital that they wanted to fund. So this opened earlier this year and has been receiving patients. Two other areas were around a staff rec room as well as a patient rec room, sorry, staff room and a patient rec room to allow patients to get up and have mobility on this specific unit. But $600,000 from just one donor last year really helped to inspire that. As I say, we work with you, the community, on a range of programs, many of which you have many attended, whether it be Charlie's Run or other activities that happen here in the communities to support soldiers. Last year, over $9.2 million. That is the most that we have ever raised as a foundation. As I said, we began in 1985, raising over $100 million to date, but $9.2 million just last year. We did receive a $3.3 million gift from a family foundation as well that disbanded last year. We're grateful for that, and we earmarked all of that money to the new hospital. Currently, without even really fundraising over the last bunch of years for a new hospital, because we did not have the news that we had this May, we have, as a foundation, secured just shy of $7 million in our new hospital fund. We do all of this fundraising with one-to-one donor conversations. Some of you I see here in the room this evening, as well as our community events that happen throughout the course of the year. Charlie's Run is one. It's a big event in May. We have Soldiers Ride, which just celebrated its third anniversary this year. So those are the types of things we do in the community, as well as working with community partners. You see McDonald's up there, Tim Hortons, and many other corporate partners that also work with us throughout the course of the year to help us raise that $9.2 million. This isn't about us as a foundation. This is about you as a community. And we're privileged to work with donors who see the way forward for what philanthropy can really do here at this hospital. And we believe it is this community that will pull together over the next while as we build out our programs. We have a special event coming up November 15th out at Lakehead University as we begin and grow the collaboration between the two organizations in the area. This is called the Evening of Something New, and it really is the beginning of something new as we look at collaboration and partnering with the community for long-term growth to build this new hospital. That's one of many activities. We've recently even launched a capital campaign steering committee. This committee is critical to the work that will go on in the future before we actually go to the public with a formal campaign somewhere in the next 2 to 3 years. But that's the work of the foundation. It's our privilege to work with the leadership team here at the hospital, as well as everyone in the community on the best way that you can help to support soldiers through philanthropic donations. And with that, I'll turn it back to Carmine.
Thank you very much, Perry, Kim, Lori, for this. We have a shameless plug here for the PFAC, Patient and Family Advisory Committee. Barb, our chair, is here, and other PFAC members. We're always recruiting patient and family advisors. That is a critical part of what we do, is hearing from those that have a lived experience in the care we deliver. So we add this slide to all of our presentations, and I know we are constantly looking to recruit so we can have active engagement of the community we serve. So with that, rounds out the formal presentation. So part of a fireside chat, minus the fire, please, is the chat. So we are open for questions. We have an opportunity to receive questions from online, but also want to ensure that we can have questions from the crowd here today. Yes, question. So we have a question here. I'll repeat it. If the hospital is looking into providing some experience for teen volunteers, and the answer is absolutely yes. Thank you for coming today. Thank you for learning. I think that's important that you're here, and it's a pretty good sign. Actually, it's a very good sign. So we will connect you to the right areas after this session. So if you want to stick around afterwards, we'll get you connected. So thank you for asking. So thank you. And yes, I want to, you touched on a lot of very important elements, and we didn't get to our strategy tonight because we were just providing an update on this. And in the spirit of transparency, yes, the numbers are present. We want to be very, very clear about that. Part of our strategy is a culture of inclusivity and belonging. That is inherent in what we do, and we don't call it a. It's not a choice. It's a fundamental. It's something that we are committed to doing. So that includes accessibility. Kim spoke to um, uh, reaching out to all communities, marginalized communities, various cultures, and we need to do a better job. We're not there yet. We need to do a better job, but we recognize that that is our role, and we learn a lot with our partners in how we can best achieve that. So. From the linguistics, we do have processes in place for multilingual translation because it's important that it's also validated for health service delivery. So there are ways, but there are numerous opportunities for us uh, to better understand the cultures we serve and have the people receiving our services see themselves within our organization. So we will definitely make connections on volunteerism here, whether that's through patient and family advisory. We'd love to hear your feedback and provide. The great thing about patient and family advisory is uh, we have something called co-design. We don't ask people for their opinions after it's done. We invite people in at the beginning to say, how do we best design this to be accessible, to be inclusive? So your thoughts are very much what we aspire to do, and we will definitely take. And if you're volunteering your husband, even better. Thank you. We'll say yes. Frank. Yeah.
What kind of time frame do you expect the kind of expenses to be incurred by?
Okay, so great question on the time frame for the new hospital. We are looking at probably 8 to 10 years of planning. It's a very comprehensive process, and it's usually 2 to 3 years of build. So there's variables with that. We're trying to accelerate that by standardizing. We're not the only hospital in the province building. Actually, we have multiple hospitals underway in various degrees in order of sort of sequence. The Stevenson Memorial Hospital, Collingwood General and Marine Hospital, Muskoka Algonquin, and Soldiers and RVH. All of us are in various stages of building. So if we can design once and build 4 or 5 times, we can accelerate the planning process. And the best way to save money, there's 2 ways to save money: standardize build so that you remove variability, and work faster because prices are only going up. So we are very eager to do both. However, the process, a hospital build is probably the most complex builds out there. So it does require quite a bit of engagement of people, community staff, as well as some pretty significant technical design parameters that we need to adhere to. So that's the explanation around the timing. It takes time, but the planning has started already.
They could be invested by the time you cut the ribbon.
So, sorry, I want to understand the question. How much?
How much money is involved here before you get the ribbon cutting and we're into the new hospital?
Oh, we don't have an exact number, but the whole process will be over $1 billion. It's pretty clear by other projects. So the exact number, it's hard to say. Depends on how well we can do with standardization, and it depends. It also depends on how long the delays in getting to the build. Yeah. So great question, Lori. Addressing the timing of we do not have to have all the money raised at the time of the ribbon cutting. So there are financing options to pay the local share off for years after. So we aren't looking at 10 years alone. Thank you, Lori. We're not looking at just 10 years of fundraising. We're probably looking on a longer time horizon of 30 or so years. But again, it depends on the funding model. There's different ways that hospitals get funded for builds, which is quite complex in and of itself. But we have, in one way, we have time to do it, but the best time to start is today or yesterday, which we've done. Great questions. Thank you. Anything from online? So we're just switching over to online for questions.
So this question seems like it may be two questions. So the first part is, will there be a cancer or heart treatment area in the new hospital?
So program planning, we're going through that process as we speak. So we do have some services available locally. So we do have heart function clinics locally that we do in collaboration with our partners. We do have a satellite chemotherapy suite. So we will look at what makes sense to do locally and where we will partner with our regional partners. And I think that's an important element. We are looking to grow the services we're providing and be better than anyone at doing what we're doing. And we will work with our partners to determine what the right mix of services are. And that we're not going to get into the specifics yet in terms of how much cardiac, how much cancer. We do some of both and we'll continue to serve based on the needs of the population. Kim, any additional thoughts or was that good? Okay.
And the other part is likely more for Perry. So they're asking, are there opportunities to donate money towards specific equipment?
Yes, there will be. We've, as Carmen talked about program planning, we are in the very early stages of all of the other planning in terms of what rooms might be named. I mean, it will all have to be sequenced out as the planning goes. And that is the job that our capital campaign steering committee and ultimately a capital campaign committee will work out in terms of how we identify the equipment, how we identify the rooms. The name of any part of the new hospital will certainly be part of it. It's just a matter of what that looks like, and that's going to take some time.
Okay. Any other questions from the room? Yes, sir.
Yeah, but I've had experience in volunteering, so can I volunteer too?
How could we possibly say no to that? That is we like recruiting early, so I think the answer is going to be a yeah. We are going to figure something out. Okay, great.
Table. And my son waited to be 9 to sit at that table.
Oh,
so he
God.
would sit at the table because he wasn't 9, and that table was technically for twins.
So
so he waited his turn, maybe for OSMH as well.
So it's wonderful. We have an exceptional program here with pediatrics, women and children program. We are a regional leader in it, and it just it's fantastic to see. And I will say, we smiled when we saw your registration. We welcome that. So we're glad you're here today. So thank you for doing that. Any other questions? Yes. Kim.
So many hospitals in the area fundraising to rebuild. Is that a concern at all, or is it kind of like sometimes our areas cross over?
Yeah.
How are we going to not compete, but how are we going to manage that?
So the question goes back to there's lots of fundraising happening across hospitals, but also across other sectors. And the approach we're taking, is a creation of value. And the best way to create value is to work in partnership. So we're not in a competitive stance. We're fundraising. Lakehead, our partners from Lakehead are here. They're fundraising. Let's do it together. Because I think a community that sees we work together, we're making good use of every precious dollar, that inspires the community to give more. They feel better about it, and they want to support something that is anchored in strong partnership and the value of working together is better. So yes, we are coordinating locally with some of those fundraising efforts with some of the other agencies. I know, Perry, you've reached out to other not-for-profits. We try to help each other out. We go to each other's events. We cross-promote because speaking from a hospital, we're more effective when we have a great lighthouse and when we have a great hospice and we have a great education institution. So we don't see it as competitive. We're cross-promoting, and yes, we recognize there is a lot of need in our community. The best we can do is make sure there's absolute value in our asks when we're fundraising. Perry, did you have?
The only thing I would add is that we've already had some early conversations and a collaborative effort on ourselves with Lakehead and with other folks in the sector. And what I can tell you is that people are speaking very positively, that we're asking them and we're talking to them about it in a cooperative way. Because I don't see it as a competitive opportunity, Kim. I see it much more as we can let all those work together and just having those conversations with children at this stage now before we all go out there.
Great. Any final questions? Anything from the online? No? Any predictions on tonight's game? They're coming back to Toronto, and we hope you get a good night's sleep tonight. Let's make it quick. Okay, so on behalf of the entire team here, I will thank you to all the co-presenters taking the time today, the staff, the board members, our partners, all of you who attended. It inspires us to do this work and see the community interest because that's who we serve. I'd like to thank those online as well for your participation, and please do not hesitate if there are any follow-up questions. We are more than happy to respond. So thank you and have a great evening.